Yep.
Okay, so want to do a little bit for hand mobility. So really working on those MTP joints, so metatarsal phalangeal joints, and then the proximal interphalangeal joints. So really working on both some palmar glides and dorsal glides to work on finger straightening out and bending, so extension and flexion. So first one I want to do is just a self-mobilization. You can do this at a kitchen counter, anything like that, is if you're limited and you kind of can't straighten your fingers all the way out. So if we're in this position, you just want to use your opposite hand, get directly over it, and directly over these joints here first, and just push straight down in to try to straighten them out some. You can do the same thing on those joints that are moving a little further out. Push down there as well. So we want to push down in, keep that pressure on, and then oscillate a little bit. And so spin in about 30 seconds or so, doing a couple times on each set of joints. Now you can do these all at one time. You can kind of get on a couple of them at a time, one at a time. It's whatever's more comfortable. We don't want this to be a painful thing. I want you to be able to feel a stretch, but not a big, sharp pain type thing. That's not what we're going for. We want to increase mobility, but we don't want to be causing any irritation. So now the second one we want to do, so that one is going to help more with straightening out. So the next one we want to do is kind of doing mobilization in the opposite motion. So using a roller, a rolling pin, anything like that in the kitchen is fine. We use these TheraBars here for this, but so we want this placed on the back side of the hand. So if we're going to work on this joint, we want this to act as a shelf and stabilize the part that's closer to the body of that, called the proximal segment. So we want that knuckle to be just off of that, so this part is stable, this part will move. And so then using the opposite hand, using kind of the base of your thumb, I want you to give just a little bit of a pull out like that, and that'll help give more space in the joint. And then all we're going to do is push down into the table. So again, pushing down into it, keeping a good bit of force on there, and then oscillating in that force, so not letting all the way off and pushing back down. So keeping some constant force in and then pushing in. So I want to do that for each finger, going through, spinning about 30 seconds on each finger. So then you can roll it out. So I want to get those other joints, so doing the same thing there, just holding there and then pushing down again, going through each finger. Last one we want to do is kind of moving back to palm down. We're just going to use this kind of as the shelf. So same thing, going just off of that joint, pulling out, and then pushing down in. And doing that same thing, then moving out to those other ones, and doing the same pusher there. It's 30 seconds on each one. Hopefully that'll help a lot with some finger mobility and regaining a lot more both of that motion and the straightening out.